Well, I'd like to tell you first that I am an OBGYN, and so I feel that I, as a doctor in this particular field, have been set up to be the pawn in this greater chess game of the political battle. Yes, women's health care has been singled out, but really, there but for the grace of God go I. As Perry was saying, it could be any aspect of life that could be chosen to be the test case. I hate being the test case when something so important as women's health is at stake. She made the statement that it's about religious freedom, and it is. But in my case, I am being asked to dispense medications, perform surgeries, do procedures that I believe are not in women's best interest. These are dangerous things. People talk about the pill as if it were candy, and it's not. It is a powerful medicine. In some situations, a woman's reproductive system is broken, and then there are treatments for that, and they may include many things and many medications. But to take a woman's reproductive system that is working quite fine and break it is just wrong, especially if you're going to break it with a medication that has significant risks involved with it. Birth control pills, for example, have high doses of hormones in them, and these have been shown repeatedly, and you can pull out the package insert for these drugs and read. These drugs elevate the risk for deep vein thrombosis. These are blood clots that can kill you. Pulmonary embolism. These are blood clots that can go to your lungs and specifically kill you. Strokes, MIs. We hear all these things about if you're over 35 and you're smoking. The Food and Drug Administration says don't even think about going on this medication. It's that dangerous. That's at the medical level. Then look at the side effect, the side effect profile. Weight gain, nausea, bloating, bleeding, headaches, the list goes on. And those things, I mean, who would want to take a medicine that made you feel like that and put you at such high health risks? And then thirdly, and probably out of all these things, I hate to say it, but the part that's being missed is that it's taking fertility, which is a healthy state, and calling it a disease, and it's reducing taking part in a miracle, that of bringing a life into this world. That's a miracle. God's invited us to take part in that. And contraception snatches that privilege and turns sexual relations into merely a contact sport. I mean, talk about snatching defeat from the jaws of victory. I can't imagine a more effective way to do that. Women deserve better. They deserve not to have their bodies violated by a medication or a mindset or an opinion that the world holds.